I'm going to come over here. Good afternoon, everybody. This is a really nice treat for us because at the time that we actually booked this space, our numbers were a little bit tinier, and now we've grown. And so there's definitely a full room, and I hope everybody's comfortable here. We also found that there has some folders, some extra folders, and so wanted to make sure everybody had one. There. Okay, my name is Patsy Beatty Huggan, and for some of you, and seeing some of you, it feels a bit of a reunion. Been lots of nice hugs around the room, and really nice to see people. And for others, I have only met people using internet connections, trying to plan the forum this week. And but I feel like I've known you all forever. So again, some big hugs, and so happy to have you here. It's been a long time in the planning. And we're just really pleased to have just a mix of people who are local and not attending the forum and those who have come from a distance. So it's a nice celebration. I'm also really pleased that I've had such great response from the people who've been using the Circle of Health in their practice. And we'll talk a little bit more about who these folks are and what they do. But I didn't have one person saying no, so that was really a nice treat for me too. So I'm just going to give you a little bit of background about the Circle of Health, and I'll highlight a few. There's a couple of people here that were involved actually in its development, so get a chance to introduce you to those folks, and we're going to do that and have a panel, and then take a tour up to see the actual wall that inspired the Circle of Health. And you can have a visit to washrooms and then come back and then have a chance to be in tables and work with the panelists on some issues. So I hope that kind of flow appeals to you, and we'll pick it up from there. So just going on, if you want to change the slide, that's basically what I've just told you. That's what we're doing, so I won't repeat it. And an introduction to the Circle of Health. I think most of you have seen the Circle of Health before. If you haven't touched it, played with it, held it in your hands, there are copies of it out on the desk. And it's one of those tools that I always say, unless you're moving it, your brain's not working. So it really helps to have that tactile feel to the Circle of Health. It's multi-layered and it's movable and stimulates a lot of innovation. It also captures most of what we know about health, and you'll hear more about that from the panelists. Go ahead. It was developed in Prince Edward Island, and who would think that something developed 20 years ago in Prince Edward Island would germinate and fly and all over the world and come back with new knowledge to bring to those of us who developed it. And that's really reminds me of the story of when I went to Scotland to study, and people were telling me that they had to go to Cape Breton to actually get the information and the knowledge about their music to bring it back to Scotland. Sometimes we have to go away to find out the perspectives that others can bring. But we were doing this because we really felt that we needed to come together. There were a lot of us who were working in different aspects of the health system at the time, which had gone through health reform. And we had people from justice, and we had people from community development, we had people from social services, from housing, all under one great big umbrella called health. And it really taken a population health approach, a bit ahead of its time, I would say, and a little bit radical. But it brought together some very key people focused on the same clients. And one of the things that we found out is that even though there was a philosophy of health promotion in our government documents, people had different understandings of what it was. And if we were going to work together, we really needed to have a framework, a way of thinking, some vocabulary that was the same and that we could share. So that was really the idea. And we came together, a number of us, and shared our information. Go ahead. Shared our distribution lists. And some of those key people that were involved in the process are right here in the room. So Julie Devon-Dodd is here as our guest, and she was very instrumental at the time in Women's Network and designed the process that brought 80-some people together into a room and space, intersectoral space, and moved us to another day where we could actually synthesize the process. And Jill Lightwood is also here, and she was involved with the agency at the time. The Health and Community Services Agency that no longer exists and didn't exist for too long, but was quite innovative at its time and worked with us in moving this forward. So really happy to have you here. In the synthesis, it was very clear that we had a need. You can go back one slide. Yeah, nope, back. People were needing a tool that would give them a common and shared understanding of health promotion because that was lacking. We also needed one where people would learn how each other related to the other. I mean, what role did you play in health promotion? What role can I play in health promotion? Where are the links and relationships? And the next was around how do we take the resources that exist and make sure that we're allocating them in a way that makes sense. We're not doubling up, that we're actually achieving some ends. So those were the purposes for which it was created. Go ahead. And because we had a clear purpose, then it was what dimensions do you need for a planning tool that will allow you to do this? So you need the where, the what, the how, and the why. And we, at that time, I think for a lot of you who have studied health promotion, you remember the Hamilton-Batty cube that existed. So there were a lot of those links that had already been made, but not completely. They weren't all there. And so we also, if you move to the next one, wanted to have a tool that people could hold in their hands. And I think that was probably our biggest push, was to have something that didn't sit in a textbook. Because a lot of frameworks are excellent frameworks, but they're ones that people study or they're in texts. And they're not something that are popular, that you can, framework of the people, so to speak. And explicitly held values. So there were people that were drawing all kinds of frameworks, but we were drawing them, we could see the elements of them, and got really stuck on how to pull it all together. And this particular visual is a picture of the actual drawing that Joe Lightwood drew upstairs. Because we were upstairs in the room trying to sort out how do we create a handheld tool that you can't take a cube and make it work because it only contained 3 dimensions. How are we going to do this and incorporate values into this? So everybody was stuck, and we went back to flip charts to try to figure it out. And lo and behold, there were 3 of us who said, let's go for a walk, brain dead, can't do this anymore. Walked out of the room, 2 people went off to the washroom, which is, what you do, and I was standing there staring at the wall, literally, and all of a sudden, I just reached up to the wall and I saw the compass rose and started hanging on to it. And right, Jill? And I wouldn't move. It was just there. And it was just like the wall was going to disappear if I let go of it. And Jill came along with a flip chart, and we drew this, came back into the room, and everyone shared their ideas. And it turned out that every single drawing had some element of this compass rose in it. So for those of us who were there, it was a very magical and kind of spiritual experience, and moved us on to the next level. We were very much encouraged by Irv Rootman, who was with us at the time as a consultant, to start getting this out into the public domain, to start presenting. And so we actually did a lot of validation and with the community. We did validation focus groups. One of our partners was Community Health Promotion Atlantic, and they had some funding to do workshops, and they said, rather than do that, let's use it for some focus groups. So a lot of this happened. One of the key pieces that really helped is there were some people, particularly in the system, that were saying that the words were too complex. People couldn't understand them. And so we consulted with a group of people who were learning challenged. I guess that's probably the best way of describing it. And they're called People First, and asked their opinion. And they really just said to us, don't change the words. Teach us what they mean. So their contribution was the learning guide, because all the vocabulary on the Circle of Health has been written in plain language so that it's there, it's available to people, and they still take pride in that. If you bump into some of the members of People First, they'll just say, that was we're really proud of that piece. The final design includes the medicine wheel, not because it came from the Aboriginal community in terms of a recommendation, but because people who were involved in some of the support networks who had experienced a lot of challenges in their lives had found that the medicine wheel best illustrated that sense of balance that's required to be healthy. And so that they suggested it go in the center, that it was something we should strive for. It's our end. And that takes us back into the center of the circle. And so a lot of consultation after that, to be respectful, was with Aboriginal communities, Aboriginal elders, to make sure that it was represented well. And one of our breakthrough moments with this was the fact that at that time, Health Canada's list of determinants of health did not include gender and culture, which is hard to imagine, but that was 1996, and it did not include gender and culture. And the more we looked at the literature, the more we consulted. Talked to Irv Rootman, and he had just come back from South America, and he said, we've got to do it. So we just took a step forward and put gender and culture into the circle, and they now are determinants of health, obviously. So it was intuition and some judgment call. So that was where it was at that time. So if we want to move it forward, it was launched in 1996, and it's been on the road ever since. Just keep going. It was disseminated through many presentations at conferences and evaluated. Dr. Terry Mitchell, many of you know, did the evaluation after 1 year. And we had a conference called Sharing the Circle, Telling the Story, which was early days of the internet and included a lot of people who were just starting to use the Circle of Health, telling their stories over the internet. And Veterans Affairs was a key partner in that. So there is a history with the Circle of Health that may have preceded some of you, but you were very much involved. And Barb Anderson actually participated in that event. So just to kind of make a loop here. The other piece that's interesting is that when it was produced, it was really meant for distribution on PEI. It was a PEI framework. And when we started to realize that we were getting requests from out of province, came up with this entrepreneurial idea that perhaps if we sold them out of province, we could use the revenue to keep sustaining the work in the province. And so all the distribution out of province was tracked. So we have records from the time it was produced to now of all of the distribution of the Circle of Health. So for research purposes, it's pretty nice, although a lot of the email addresses have changed. It makes it more difficult. You want to keep going? Why of interest today? Just because we didn't anticipate the uptake or the enthusiasm of users. There are a lot of practical applications for it. And as Terry Mitchell would say, the strength of the framework, theoretically, is very strong because the way that you use it is congruent with the way it was developed. And so that really places it in a place of its own. And the other is that circles are inclusive. And so without speaking about inclusion, it's an inclusive process. And I think the final piece is that it appeals to a wide variety of learning styles. So you can be a visual learner, a reflective learner, a tactile learner. There's all kinds of ways that you can use it, and it appeals to all. It's relevant across cultures, so we've been in Serbia and in Brazil. It's now translated into 6 languages, and it keeps progressing. It's many, many applications. So you can see in curriculum, for planning, for research, and you'll hear more about that from the guests. And what the Australian reviewers really helped with is not a calorie counter. You can't line up the rings and get an answer. It's a trigger tool. It really makes you stop and think. You come up with innovation, and that's a mind stretcher, expander, and you'll hear that from some of the speakers. Each of the pieces of the circle are a piece of a puzzle, and that really helps with knowledge translation. So I'm going to just move forward. But one of our biggest challenges was linking, and it is always with the work we do, is how do you link those conceptual thinkers and practical thinkers? And so that has been a big challenge, and that's one of the areas where Julie has really worked together with me to try to gather stories, to try to reflect and create some products, and we keep going. So we've had think tanks, we've done surveys, we've actually virtual conference, all kinds of ways in which we could gather the knowledge and the skills on how people are using it so that we can assist other people in trying to achieve the goals, not just by using the Circle of Health, although that has really been helpful and powerful, but also to think more about using some theoretical knowledge to make a difference in terms of their work. So resources, we've got lots of them, and those are listed here, and we have 2 websites. The Quake is one, but we have a circleofhealth.net website that you can go to, and just go breeze through these. These are just some of the different resources that we have available now, and we do have more online workshops coming up in November. The workshops were evaluated, and actually Dais did an evaluation of the online workshops, and we'll just, I can give more information to that, but it was, they were very positive, but they also made suggestions, and we've been working to improve those. And Wendy Craiglin-Gauthier down there has been with the St. FX distance learning and really been helping a lot with using different platforms to try to get out and reach that. So this is our facilitator training, and Julie and I have been doing that. We've been facilitator training in Vancouver and in Ottawa and in Charlottetown last year, and have a facilitator manual. And I think that is probably the summary from what I can see, is that the Circle of Health is effective as a teaching and learning tool, and it does provide a common understanding and shared language. I think it's a great discussion point to begin with values, and gives us all a sense of the roles we can play. And anybody who heard the interview yesterday on CBC, I got my words mixed up. I'm just so tired, I can't even tell you. But my daughter says I do guerrilla marketing. That's what she calls it. I ambush people on planes. They have nowhere else to go but to listen to me talk about the Circle of Health. So it gives you a big holistic and big picture of health and lots of fun. And I think that's the part that I like to bring into the work, is that sometimes we're all so serious, and life can be very serious, and we need ways that we can work together and have some playfulness in our work and still address our serious topics. So I want to thank you for that, and that's my introduction. I'm going to turn it over to our moderator. Do you want to just go one more there? I think that's enough for me. We've got great visions of what we want in terms of having a better world, and we're working hard at it. And this is the group that we have together, and Christina Murray is going to moderate. I think we also will explain the process here. Our intention is to hear the panel, to ask a question or two, and then have a break, take you on the tour, come back, and you can work with one of the panelists on issues, and then after about 30 minutes or so, you can get a chance to work with somebody else, so you can move around and get to know them a lot better. So that's it for me. On to you. There you go.
So welcome everyone today. I am thrilled to be part of this wonderful dynamic learning afternoon that we have together. The Circle of Health is something that is to be celebrated. 20 years of celebration of where this has been, from this hotel to where we sit today, and where we think to the future. And for me, I was thinking about this actually the last few days, that the last 20 years, this circle has become so much of a part of who I am. I started being exposed to this in 1997 as an undergraduate nursing student at UPEI. So fresh when the framework was just evolving, it was part of a fourth-year community course, and so did some work with that. When I graduated, I moved on to Calgary, and I started teaching at the University of Calgary. And it just was such a natural fit to me to be able to embed this in the work that I was doing with students in community, in population health. And so over my life trajectory, my professional life, my personal life, I've always been drawn to this circle. And so the circle has guided me in research. It was a foundation piece for my PhD. I live the circle. I feel that in my bones, that the values that are so inherent to that, of working with people, collaborating with people, being in partnership, it's so much of a beautiful, versatile tool that can be used in so many places around the world. And so this afternoon, we have a wonderful opportunity to learn how this circle has been used in education, in policy, in practice, in education, from coast to Canada and around the world, in Brazil and in Serbia. And so what we're going to do now is each of our guest panelists are going to have about 12 to 15 minutes, and they're going to share their stories of working with the circle. And so we're going to begin with Barb. And so I'll just read off the bios of each of our wonderful panelists that we have today. So Barb Anderson is a professor and director of the School of Nutrition and Dietetics at Acadia University, assuming this position in 2009 after a 30-year career with Nova Scotia Public Health. Her research focus is food security, having been involved with Nova Scotia food security projects for over 15 years. Barb is interested in working with the local community around healthy food issues, and as a result has developed a partnership between the Wolfville Farmers Market and the Nutrition Department. Barb was president of the Nova Scotia Dietetic Association, chair of Dietitians of Canada, and president of the Canadian Foundation for Dietetic Research. Barb is a fellow of Dietitians of Canada and is a life member of the Nova Scotia Dietetic Association and Dietitians of Canada. She was the nutrition voice on a CBC radio phone-in program for 20 years and has been an invited speaker at over 30 provincial, national, and international conferences. So please welcome Barb.
Thank you. Thank you, Christina, and it's great to see everybody today. I love to come to Prince Edward Island. My dad's from St. Peter's Bay, so it's kind of like going home. It is like coming home, isn't it? So first of all, I think it's in some ways setting the stage by looking at teaching and learning, which is the piece that I'm going to share with you for the next number of minutes, is a really integral part of trying to figure out how do we get people used to thinking about big picture. And Christina, you spoke about being a student nurse a number of years ago, and one of the things that I find is when students come in to the nutrition and dietetics program at Acadia, they really are very clinically focused and they're thinking about individual health. So trying to challenge their assumptions to think about a broader perspective and a broader view of the world is truly what has brought me to the way that I'm going to share with you today what I'm trying to do with this group of kids. So next slide, Judy, thank you. So just in case you're not familiar with where I hail from, obviously Wolfville is right at the apex of that little black line in the middle. It's right on the Bay of Fundy. It's a pretty beautiful part of the world, and downtown Wolfville is a very special place. If you haven't been here, I can do a travel log. And Acadia University, it's certainly one of the a beautiful university campus, as many of the campuses in our maritime provinces are, and University Hall, which is certainly one of the center points. So just to share a little bit of where I come from. So I came to Acadia after a 30-year career in public health. I started as a public health nutritionist, and then I worked for the last 10 years as a manager and a director in public health. So one of the things that I was used to doing was thinking about strategies for change with public health staff. And I worked with nurses, dental hygienists, nutritionists, health promoters, admin support staff, because they're often the ones that you really need to talk to in terms of getting an idea of talking with the public. And so it was, how do you begin to change people's assumptions and change people's view of the world? And so after a 30-year career, I was offered an opportunity to work at Acadia. It was an administrative and an academic appointment. So I stepped in as director of the School of Nutrition. There was a few little minor issues going on that I was hired to bring people together and to begin a collaborative process with the faculty and the students. So it was a wonderful chance for me. But what I also do is teach. I teach the community nutrition course. I also teach a first-year foods course, which is really quite interesting. That's going back to very big roots for me, but it's a way that I've been able to connect with the farmers market and with food and with a community approach that is actually different, but we've been able to make it work really nicely. So what I needed to think about with these 50 students that I get in a third-year undergraduate core nutrition course, so they have to take it, is what could I do to get them to look at the world quite a bit differently than when they walk through the door. And when I listened to their assumptions about why don't people just stop smoking? Why don't we pass out more Canada's food guides? Because that's really what's going to help people to eat better. Why don't people stop having as many children if they're having trouble feeding them? Like, truly, this is a lens that these potential future practitioners have when they step in as 18, 19, 20-year-olds. Or even 40-year-olds if they're coming back to school. But it's really very challenging to think about what do you need to do to turn that light bulb on. So what I did was I actually connected with a variety of individuals to ask their advice about what do students need to know when they go out and practice in a community setting. What are the things that if I was to start to set a curriculum, what do you want me to cover? And I talked to current students, past students, students who were in dietetic internship programs, which is the practicum component of becoming a dietitian. I talked to people in health policy within the province of Nova Scotia. I talked to dietitians and nutritionists within Nova Scotia as well. And what I got was a wide variety of advice, like a lot of advice. And I know these people, so they responded to me. It wasn't difficult to get responses back. And what they told me is they really wanted the students to understand the Ottawa Charter. A lot of them were going out into community placements. They'd never heard of it before. That was a little embarrassing, but that's what I was told. They wanted students to understand a population health approach. They also wanted students to understand the social determinants of health. And certainly coming from a lens where I had been working with staff to challenge their perspectives from an individual to a clinical focus, that was certainly something that I really thought was very important as well. Also, the values underpinning community health, they wanted some voices from the field to come in so the students would hear from people that were actually working in a community perspective, and they wanted to learn about, they wanted me to talk to the students about existing strategies on health. So whether they be for seniors, whether they be for school food, whether they be for poverty reduction, housing strategies, they wanted the students to understand that there were things that were already existing. So I had a bit of an aha moment because, like Christina and some others here, I had been involved in some of those early focus groups related to the Circle of Health. I had used the Circle of Health with public health staff to get them to look at the world differently and to talk about strategy development in public health in Nova Scotia. So why not use it as a textbook for students in a third-year nutrition course? So that was the way I started to think about the Circle of Health. And certainly it is a foundation piece, I think, as Patsy said so well. It does trigger people to look at things a little bit differently, to try to challenge the assumptions of individuals, of students, of others, to think about the world differently. It does cover a health promotion framework and covers the component parts that really are part of a really good textbook. You can't write it better yourself. And the Ottawa Charter as well, which is something that's really important to cover, as the advice was that I got from the folks. And as you look at values, the importance of partnerships, those are also component parts of the Circle of Health planning, evaluation, strategic development. All of those are what we need to look at. And those social determinants of health. Remember, those students are coming in looking at individual approaches. That's the world they know. And so to really open it up for them to look at things differently, the Circle of Health, I thought, would allow them an opportunity to do that. And then the holistic health, the medicine wheel, allows again for a really broader perspective around what do we need to consider related to health. And it was local, so Prince Edward Island is local to Nova Scotia. And it was tested and it was understandable. So the language is language that the students would understand. So, yeah, thank you. So the course itself, this is I won't take you through all of these pieces, but at the end of the course, I do a journey map with the students. So I go through with them all of the things that we cover in the course so that they remember where we've started and where they've come from. And it really is quite, for them, you can kind of see oh, I can't believe we've covered all this, but the whole course is about creating a community. It's about how can we work together so at the end, you create what you hope that they can go out and do in their own communities. But the centerpiece of it is the Circle of Health, which is framed the first week and is used as the underpinning of the whole course. The other thing that I do very quickly with them is within 2 weeks, they're presenting on the social determinants of health. So they very quickly have to learn how to work together. They have to learn how to give each other feedback. They have to learn how to develop relationships. They have to learn about community engagement. They have to learn some of the theory related to each one of the, and I do add the biology and genetic endowments as a social determinant because it is in the Public Health Agency of Canada list. Then they individually have to review a strategy that has already existed across the country that they get to pick from a list, but they're on housing, they're on seniors reduction, they're on health promotion, they're on school food, they're on breakfast programs, school gardens, whatever they pick, and they have to apply the Circle of Health and decide where the alignments are, where the disparities are, and what the recommendations are that they would make to bring strategy in line with the Circle of Health. So they really have to work with it as a tool and then do a elevator speech to the class. So one of the things I also want them to do is learn how to speak well, to get comfortable talking, and to get comfortable talking about difficult topics as well. They have to do a community project where they actually give back to the community. And one of the things that I do with them is that project, they are not marked on the deliverables, they're marked on their participation. And the idea for that is not that they focus on the grade, but they focus on the project. And it's actually been a fairly good way to do it, even for those students that say, what is it that I need to do to get 20 marks? And I say, you step in with energy, enthusiasm, gusto, and you will do fine. If you focus on the marks, you will not. So, yeah, that changes the world pretty fast. And then they do a reflective paper. So that's actually the way that I get a great sense of what they're thinking about all of the mind-blowing things that have happened to them. They understand all of a sudden that people's worlds are influenced by much more than a piece of paper, much more than one seminar that they go to, much more than, sort of the world that they are used to, which is often going into a doctor's office or going to a dentist. That's what they see as being health practice. And so that's where I've seen some successes, is truly when speakers have come in and they're not asking them why in the video are people smoking. Like, why are we not dealing with the smoking cessation? They want to know, how do we get at the poverty reduction? How do we help seniors to stay in their homes for a longer period of time? How do we ensure there's transportation systems so people can access some recreation or access education? So the systems are much bigger. And even though it's a nutrition class, to me, the class is really about some of the broader community health issues, because if they don't understand that, they're not going to be good practitioners, no matter where they go. And most of them are dietitians, but some go into medicine or nursing or occupational therapy or food science or whatever, and they can take those values with them no matter where they go. So I do a World Cafe. Most of you are probably familiar with World Cafe format at the end of the class, and that gets them to talk about what have they learned and what are the things that I need to do as a teacher to be better, and what are they taking away from the class that they can use in their own practice. And it's on the left-hand side, or my right-hand side, your left, what you're seeing is some of the comments that they've made about the course, and right in the middle is the circle of health that connects everything. So on every comment sheet, you're going to get how important the circle of health is, but you'll also see, don't make assumptions, food literacy, food skilling, social determinants of health. Like, the language is pretty clear, what they learn. And it has challenged the assumptions of students in the course. It's provided an understanding of health promotion and a framework for the application of knowledge. So even though it's an undergraduate course, a third-year course with 50 students, there's 50 to 55 students in the class, one of the things I've understood is that you can take an approach like this and apply it to adults, to health professionals, to others. I mean, obviously the grading is a little different, but the learning potential is there no matter how you do it. So if you're interested in any more information, I'm happy to share my assignments, my curriculum, kind of where I've come from. I'm happy to share all of that with you. And my email is just my Acadia email. So please ask questions. But I think if you talk to any of my students, they will tell you they come out thinking quite a bit differently than when they went in the course, in as an environmentally safe way. So, I give them some protection while they're having their minds blown. Yeah.
Does anyone have any specific questions to Barb in regards to the work that she's doing?
I know we don't have a lot of time, but your last comment is intriguing. How do you keep them safe while you're blowing their minds in a teaching environment?
Yeah.
Just a couple of things.
Yeah, so my background's adult learning.
Yeah.
And so, I'm really trying to set a comfortable space right from the time they come in. I get them to, we do a mural, the very first class, with what are the skills and experiences that they bring to the class.
Mm-hmm.
And they introduce each other so that right from the beginning they speak that very first class. What I try to do, I do a session on giving and receiving constructive feedback so that right at the beginning they understand not to go for the jugular when they're asking questions, and about how to ask good questions but thoughtful questions So again, trying right from the beginning, how do I do this in a way that ensures that students are safe? Oh, sorry. How you can probably hear me, can you? Yeah. How do I do this so students can be safe, and every time a little teachable moment comes up, like if somebody does shoot across the bow, I'll go back, and the other thing we do is set up class norms, and we monitor them a couple of times during the class too.
Okay, so our next panelist is Tanya Hill. Tanya Hill, she is the Healthy Communities Coordinator, Active Living for Hastings, Prince Edward Public Health in Belleville, Ontario. She has nearly 20 years of public health experience in policy and community development. She is a health promoter at Hastings, Prince Edward Public Health in Belleville, Ontario, where she works as the Healthy Communities Coordinator for Active Living Initiatives. On the side, Tanya has a small consulting firm that helps organizations and collaborations achieve their goals in fostering healthy and engaged communities through planning, evaluation, and capacity building. Tanya is passionate about engaging communities and building partnerships to create vibrant, healthy places to live. She's a graduate of the University of Alberta with a master's in public health and health promotion and a BA in recreation administration.
I'm just wondering where I should stand so I can see my notes. Is this okay, or am I in front of the screen? If I move over? All right. All right, so I come here from Belleville, Ontario. I should have put a map, but we're about halfway between Toronto and Kingston, if you know the area. My presentation is going to be about the project that I've been working on for the past 3-4 years with our Healthy Communities Initiative at Hastings Prince Edward Public Health. You want to switch? So the Healthy Communities Partnership is a network of agencies, municipalities, and residents that are committed to working together to create vibrant communities where healthy living is effortless for everyone. This initiative recognizes that promoting health involves promoting the health of the community by fostering social and physical environments that provides easily accessible and affordable opportunities for health. Hastings Prince Edward Public Health is the lead agency for this partners, and that it's evolved to have many different little partnerships around different issues, which I'll get to at the end of the presentation. Public health in Ontario, we're mandated to work both with municipalities on policy work and with community partners. So through this initiative, we're able to bring those two groups together to create vibrant communities. So I'm going to share with you the mission that our partnership has been on to start and sustain a community conversation about health and all policies for healthy eating and active living. And I'll share with you how the Circle of Health was part of this strategy that helped get us to where we are today with the collaborative, community-driven working groups to help move change in our communities. And I sense a bit of a theme here from Barb's partnership. This is really focused on changing the way people think about health. And I think that is one important thing the Circle of Health does. It gets people out of the traditional, conventional frame of thinking about health as individual responsibility to thinking about it as it's everyone's responsibility. And really, that's the foundation of health and all policies. Municipal decision makers, community groups, everyone has a role in creating communities that make health effortless. Before I continue, I'm going to tell you a little bit about my aha moment that I had when I did the facilitator training with Patsy in Ottawa. Our funding for the Healthy Communities Initiative was dedicated funding we had for about 3 years from the government, and we were focused to work solely on healthy public policy. So I went into this facilitator training. I heard a little bit about the Circle of Health, and I wanted a tool to help bring our partners together, and I thought this would be it, and it certainly was. But as we were working with the public health, I'm really focused on public policy. I'm really working with it on public policy and moving it around and just focusing on public policy on the Circle. And then all of a sudden, it just kind of dawned on me, and I knew this. I intuitively knew this, but it just helped me articulate it, that we can't change policy unless we pay attention to all of the different strategies. I don't know if you remember that, Julie, but it was a big light bulb. I'm like, well, I knew that. But yes, okay, so now the whole strategy that I'm going to talk to you about is going to show how we used all the different strategies to help, build our partnership and create change in the community. So we started off by doing some formative research. We reviewed the academic research and set some policy priority areas based on the evidence for healthy eating and active living. But we also felt we needed to understand the municipal decision makers and a little bit more about what they were doing. So we did a survey of decision makers, and we also did a review of municipal council minutes and committee minutes to see what they were talking about. So what we learned from the survey is that municipal decision makers do indeed believe they can have an influence on the health of people in their community, but they didn't understand how a community is built or structured, or the resources in a community affect people's health. So there was a bit of a disconnect. And then from the document review, we learned that they were talking about health only in relation to hospitals and healthcare and recruiting doctors. That was the only word of health. And there was a little bit on farmers markets, but it was always with an economic development lens, which it is, but it has much more opportunities for health than just economic development. So we realized that we needed to create some After that, we wanted to understand what the people thought. So we did a big survey of 1,200 people and asked them what their perspective on some different policy issues were. And we had astounding results. Between 81 and 90% of residents that we surveyed had support for a range of different policies that increased, the number of healthy food sources in the community, provided more opportunities for walking and biking, and more opportunities for recreation. So there was obviously a disconnect between what municipal decision makers were talking about and what the people wanted. And maybe even those people didn't really know how to articulate it to the decision makers as well. So we needed to create some alignment between these issues. So you can go on to the next one. We developed our communication and engagement strategy. We developed some key messaging. Again, resident engagement, as well as engaging with the municipalities to build their knowledge and skills around health and all policies and what makes a healthy community. And of course, to develop some partnerships to move things forward. Next slide. So this is our key messaging, innovation, collaboration, and equity. And using this key messaging, we developed a government relations strategy that included the creation of the Healthy Communities Declaration. I think that's the next slide. So we developed the Healthy Communities Declaration, and this is a tool that we use to help educate decision makers and community organizations on health and all policies, and what that means and what that looks like. So we went around to all of our 18 municipalities, did a deputation where we presented the results of our situational assessment and asked them to sign this declaration. What it does, it commits them to developing processes to move health and all policies forward. So they're not committing to one specific policy or anything, but they're committing to maybe working with us when we have a specific project for them to work in. So 15 out of the 18 councils signed it. 3 of them just accepted it and said, great information, but they didn't sign it, which I think is pretty good in the end. And we also have about 25 community organizations who've also signed the declaration. You can go and see all of this on our website, and I'll give you the URL at the end of the presentation. So we also did community engagement. We had a very large campaign called the What Matters to Me campaign. We had 5 different residents share with their municipal decision makers what healthy community issues they would like to see changed in their community. We focused on community gardens, parks and trails, affordable recreation, as well as walking and biking. From this, we produced some videos and some fact sheets, which are also on our website. I was going to show a video, but I thought it'd be just a little too long today, because I want to get into the circle of health. Next slide. So once we engaged the community, we had some money, and I had this great idea, and I phoned Patsy up one day. I said, I think it's time to use the circle of health, where we could bring our partners together and talk about how we can move forward on some of these important issues. No problem. We use the Circle of Health as a framework to structure the discussion amongst these 40 potential partners. So we had partners from municipalities, elected officials, community organizations, nonprofits, agriculture. We had a very diverse group there. And what it did is give everyone this common language and frame of reference to collectively answer these questions. Next slide. What are the health issues and goals that we need to focus on? How can we improve the situation? Who can help us improve the situation and who's affected by the situation? And what determinants we should take action on. And most importantly, we left the day with shared values, and those shared values brought the commitment from the different agencies to the table. Next slide. So this is what we ended up with the next day. So I have this in your packages if you want to be able to read it, because I'm sure you can't read it off here. Our steering committee then took all of the information that we collected those days and developed an action plan. So this one you have is for our active transportation action plan. And then from there, we were able to go to the next slide, develop a more specific logic model to help guide our planning and evaluation of this project. And this is still, the logic model has evolved over the last couple of years, but it's still quite close to what you see here. And you can see how both the action plan and the logic models make a lot of sense, and they're very linked to the Circle of Health in terms of strategies and determinants of health. Next slide. So we developed these goals out of this session. I'll just click through and put them all up. Our goals were to develop and support the implementation of active transportation plans in our small urban municipalities. We wanted to encourage a culture of cycling, because we had partners really excited to work on that. We are supporting the development of non-motorized trails in the rural parts of our region. And we're building capacity to develop community gardens, and we're continuing to always have input with municipalities on land use planning. And so this is what resulted out of this in terms of partnerships. Next slide. We had a grow session to grow a community gardens network in Hastings and Prince Edward counties, and this network has officially been incorporated as a nonprofit as of next month. So they're independent, working with municipalities on policies and organizations to develop community gardens. Next slide. We had Bike Month in the Bay of Quinte. We started out in Belleville and grew to Quinte West, which is our neighboring small urban municipality. And then we also had another session where we brought, next slide, decision makers and stakeholders together to talk about creating a 5-year plan to implement bike-friendly communities in the area. This resulted in Belleville allocating $3 million over 3 years to implement a network. Unheard of, staggering, get it done, being spent. So that was a huge win. And the City of Quinte West has hired a consultant last week to do an active transportation, another big policy win for us. Next slide. And we have a fantastic partnership working in the north part of the region, working to develop a non-motorized trails strategy in Hastings County. If you look at Ontario and all the non-motorized trails, there's this big black hole in North Hastings. So they're really working hard to fill that hole through this project. So some lessons I learned is take the time to do the situational assessment and see where the gap is and where you need to create alignment. Use the strategic communications to change the way people think from a community issue to an individual issue, and then have the purposeful partnership development, using a framework to bring the values and language together. Sorry, it was too long. So there you go. I didn't need my notes back.
So does anyone have any questions for Tanya in regards to the project? So our next panelist is Dais Rocha, and she's a professor of health promotion and health education, human rights, culture, and society at the Department of Public Health, Faculty of Health Sciences, University of Brasília. Brazil. She's an academic advisor and professor in the UNESCO Chair of Bioethics Program at the University of Brasília, co-coordinator of Theme Group on Health Promotion and Sustainable Development of the Brazilian Association of Collective Health. She is taking action on the following subjects: health promotion, intersectoral action, democratizing the health sector, advocacy, public policy, and evaluation for reducing inequities. Dais has her master's degree in public health, health education from the University of São Paulo in Brazil, a PhD in public health, health promotion at the University of São Paulo, Brazil, and was a visiting scholar in the School of Public Population and Public Health, University of British Columbia, Vancouver, in Canada from 2013 to 2014.
I'm very happy to be here and to know these people that really, really are involved to promote change, personal change. Then I'd like to say I am an enthusiastic user and teacher of Circle of Health, and it's so important to me celebrate with you, Patsy, and all team that is working on this the last 20 years. And I'm here as a professor in University of Brasília, but I would like to say that I'm involved in our National Association Public Health, Abrasco, because there you name it collective health, and because you are very close to the social science, since the 80 years, you changed this. Then, next, please. And I built this presentation focus on 5 points. Especially, it's important to understand how we get involved in Circle of Health in Brazil, and you have a context of the partnership between Brazil and Canada during 1 decade, until now, where is planning something with Patsy and the Circle of Health for the next years. Next, please. Then it's important to know that between 10 years, the CPHA, Canadian Public Health Association in Abrasco, our national association, established a partnership, and I was involved in this partnership during 2006 and 2010, where Patsy was one of the speaker or facilitator to work with us, that we are involved in this project to promote local capacity to implement and evaluate intersector interventions for promote health and equity at the local level. Next, please. And it's important to highlight some similarities between Brazil and Canada, the same way that Ottawa Charter you are launched during the 1986. It was the year that my country, the people had the right to have public health. Until this moment, you had only people that have a job, if insurance, that you have the right to have health. And our conception of the health, it was very close to the prerequisites of the Ottawa Charter. You had start with the broad view about health, what we are doing in the same direction. And the other things is to have a universal health system, and our government system is very close to the Canada. The difference is that our federal influence more than here. Here, the provinces are very vigilant about this. There, our federal government has more influence because the money go directly to the federal, and it's distributed for the states. And the other thing is you are involved in the social discussion, how implement and to really address our actions to the social determinants of health. Especially, you have invest in papers and tools to know more about address these inequity challenges. Next, please. Then you can see in 2008, you are implement a national commission of the social determinants of health. After that, you hosted the World Conference about on social determinants. You hosted to the Rio Plus 20, and you have had representatives in the Commission of the Sustainable Development Goals. And this year, on May, you organized the World Conference of our International Union of Health Promotion and Education. This reflect how you are involved in this discussion. The next one, please. Especially, there's a big challenge, really remove these barriers that there are people to have access to our social research. Next, please. And I use a timeline to highlight the key moments that you have implemented the cycle of health in our reality. Next, please. In 2008, I was a participant of this workshop with Patsy, and how it's impressed how people are describing aha moment. You had this, it really affecting personally and professional my life, because I was working with this group more than 2 years, and never we had asked ourselves what values are oriented our actions. And it was important to, in this moment, you had in the same place people from community, from government, from university, professors with PhD, professors of elementary school, different kind of people in the same room, if they are the same picture in some moment, helped by circle of health. Then, in this moment, you really identify our core values, you recognize this tool as a potential, and you invited Patsy to go back to Brazil 1 year after. There is our the president of our university, the ambassador of Canada in Brazil, because you need to share how important the connection with this tool, what is helping our community, what are you doing, what are you teaching, health promotion, how you describe, Beb. Plus. In July 2010, I moved to Brasília and work in the University of Brasília, and we were invited to help the one region involving 200 people living there, and where they have the challenge to build their health promotion plan. In this moment, you use the circle of health as a lens to analyze how close they were of the social determinants of health. Next, please. And here are some quotes where they describe how you are over-prioritizing systems and services and ignoring communities and families. You must improve community participation. Evidence indicates that gender is a primary determinant of sexual violence and traffic accidents, but it was not addressed by any participant. Though it's so important to recognize how Circle of Health is a self-evaluation, self-teaching tool. For us, how we work in the university, you try to build our horizontal relationship. And it's very important to have this kind of material that people can analyze their praxis and reflect about that. Next, please. And the next moment, in this moment, you are living in Brazil. In 2014, you had a process to review our national policy. And in this context, it's very difficult to think how you can disseminate this national policy, especially a big country where you have different kind of possibilities to assess educational process. Then people, you implement a survey with representatives from different secretaries and municipalities, states in our country. They asked or demand for increase the commitment in critical and reflective capacity of managers and health works. And you start to think about using online strategies to do this through our country. Next, please. And this year, on May, after our road conference, Pets stay with us again. And you, after the workshop, in this period, you involved representatives from the Ministry of Health, people from PAHO, our Pan America Health Association, and 3 different universities in 3 different states of the country. And they recognize Circle of Health as important strategy to disseminate our health promotion policy. And the proposal of using a multi-layer mandala contain values, strategies, objectives appears to be a great tool for self-evaluation. And more than this, I think is how change the personal view of each participant, because there were people there working with health promotion more than 10 years, and they described that it was a deepest immersion in health promotion, its relation with social determinants of health. Then they change the way you think about what you're doing. People involving in different areas of our Ministry of Health. Next, please. And sorry about this, I think they change, but in the end, they recognize that can use the Circle of Health to build the theoretical frameworks of health promotion, support my research as well as instigate ways to actively apply the Circle of Health in the participatory research, to do research too, but with people, and show very clear the role of all the actors involved in the process, disseminate health promotion concepts, especially but intersectoral way, and again, be a self-teaching tool. Next. And although the demand for graphic teaching materials exists, we rarely find a way to provide it. Then now I introduce one of our next steps. Some people connect with the Ministry of Health are asking to adapt the Circle of Health for our reality. What this means? They would like to explicit racism in the Circle of Health, because this is a big, big problem in our country. You are acknowledged by your democratic way to live, but in truth, you have a national policy to promote health in the Black population. You have specific policy for indigenous population, because this is a big challenge for our reality. And you are discussing how adapt without lost the universal perspective of the Circle of Health. Then this is debate between universal and specificities. Consider the core concepts, strategies of the Circle of Health. The next one. And the other thing is to finish the design of a multicentric research involving people from our 5 macro regions in Brazil. You have now one professor from the nutrition and doing her PhD in Rio de Janeiro, and other 2 master's students involved in this process. And to get funds to co-facilitate online workshops, now in partnership with our National Association of Public Health, to create a task force to plan and operationalize the online workshops for 2017-2018. To do this, you need at least involve 2 system pros. For example, in this moment, you are involved into change, retooling our curriculum, the curriculum of our health courses in Brazil. You have now new directions to do this. And you believe that you need to change simultaneously health system and the educational systems. For this, it's very important to have a tool that establish horizontal relationship between university services. Next, please. But next, it's very important recognize that this moment arrived austerity wave in my country. Last week, our Congress approved a new law. They changed the Constitution to cut the budget is to freeze the budget for the next 20 years in the health and education area. Can you imagine it? And this austerity wave is coming not only in Brazil. Portugal and other countries that I had the opportunity to visit recognize how health promotion has been implemented in primary care. I visited different regions, and you see, and I select these affirmatives from our Curitiba Declaration that you build in this in our road conference last May. You need to recognize that austerity causes inequity, a socioeconomic system that accelerates this. You need to really have strategies to change this. Recognize that citizens' participation in health decision is a right, not a concession or favor. And it's very important, the meeting that will start tomorrow here, where you are open to listen from the society, civil society, because, next please, you need to be very close to the society. All initiatives that you have to occupy, to resistance, you need to do this, really very close to the population. Here, our students, over there is the students of medicine course of my university on the street because they want public education. Then the other is students in São Paulo, the elementary level, in the middle of the streets, strike everything because they try to provide the privatization of our schools. Then, next, I use my shattered piece to create a mosaic. You need to learn this in difficult times, in austerity times. And I'm very hopeful that to be together with you and try to plan our next steps, consider this context, but hopeful that there are people that are trying to do difference where they live. Thank you so much.
Does anyone have any questions for Dais?
I think you have some moments after, yeah? Okay.
Our next panelist is Paula Ardiles, and she is the president of the Public Health Association of British Columbia and a lecturer at the Faculty of Health Sciences at Simon Fraser University. Paula was awarded the 2012 Dr. Nancy Hall Public Policy Leadership Award of Distinction for her local, provincial, and national work to advance the mental health promotion agenda. In 2013, Paula founded Bridges for Health as a volunteer health promotion self-organization network with both local and global members. The network has grown into a newly established co-op association focused on social innovation, research, and consulting to advance leadership on social and environmental responsibility. Recently, Paula launched Simon Fraser University's first ever Health Change Lab in partnership with the local government and health department.
Great. Thank you, Christina. Thank you, everyone, for having me. It's a pleasure. My first time out here in PEI. I'm from Vancouver, as you can tell, and I'm really happy that I also have Marco Zanone, who is from our youth engagement lead with Bridge for Health, and he's also happens to be a student in the Health Change Lab that I'll be talking about. So we're going to be listening from Marco as well. I just wanted to say I really love circles. This is a model that I created. And it's basically our social enterprise model for Bridge for Health. And what we are doing is really, it's a co-op, so a collective of people that have come together to offer research and consulting, very much linked to this whole idea of transforming the way people think about health in different settings. And so what I'm going to be showing today is a little bit of a research project that we did. You can move on to the next one, which is, we called it Moving Health Literacy Upstream. And I just wanted to know how many people are familiar here with the concept of health literacy? Okay, so almost everybody. So As you'll probably know, health literacy has been used mostly in terms of tools to be able to support people in assessing, evaluating, using health information. However, most of it has been done up to now in the healthcare context. So the majority of it has actually been to improve people's literacy around disease prevention. And a lot of it has been in terms of trying to find people access to information, for example, about how to manage diabetes, prevention, and I think all of those things are really important, yet I felt that a lot of the initiatives were actually missing the health promotion lens. And so what we did was we actually created this project to really support the shift to a more holistic understanding of health, but also to understand, of course, how the social determinants influence our health and the importance of participation in youth engagement. So it's really nice to be at the end because I'm kind of building on everybody else's presentations. I just wanted to acknowledge this was the team of students that were supporting me. There, I had a student working for me from Wageningen University, and also the other people there were advisors and the participants of the Youth Warrior program, which were the young people that actually participated in the program. So our research question is, how could we use the circle of health and photo voice as tool to foster holistic health literacy for youth? And we used photo voice because we thought it was really well aligned in terms of it being a really participatory process. And what I loved the most was this quote that I found about really enabling a democratic practice of young people actively engaging with their social environment and making them decision makers. One of the beautiful things that came out of our discussions was we were at that time in a provincial election, and what came out was about that voting was actually a determinant of health, that it was actually really important for youth to get out there and start voting. Those are the kinds of interesting conversations that we had. The Youth Warrior program that we worked with was a program that was really focused on healthy living initiatives, and they were supporting a lot of Indigenous and immigrant newcomers and Indigenous youth that were already, we know, were facing a lot of challenges already in their own social and built environment. And the goal of the Youth Warrior program was to really engage them in a lot of leadership training skills. So Bridge for Health came in to support the Youth Warrior program in basically deepening their understanding of health and contributing to this leadership development model that they already had established. So this is one of the ways that we use the circle. So if you're not familiar with, there's an amazing puzzle that has been developed as part of the circle. And I love using the puzzle as an icebreaker. So when people are not familiar with each other in the room, in this case, we were total outsiders coming in to work with these young people, we thought that it was a really great way of opening up the conversation and just finding out from their perspectives, what does health mean to you? Now, for us here in the room, it sounds like a really, really simple question. However, the findings of this was absolutely remarkable, and the tool, everybody, basically was distributed the pieces of puzzle, and everybody kept adding to the puzzle until it was formed. And what it did was it actually built cohesion amongst the group as we were discussing, the different aspects of. So we were talking about what does the holistic part of health mean, and what do the determinants mean, and where does this all take place? So we were actually able to use the different layers of the circle as people were doing this this icebreaker activity. These are, you can't really see them up here, but I thought it was really fascinating. This was the first entry point. So a lot of the things that you'll see there were things that you would expect. So what does health mean to you? Some people said fitness, sleeping, music, healthy eating, mental health, things that we would expect on a first sort of round of conversations before we actually had done the work with them. And this is what came out after. So these are part of the findings these are the photos that they took. So from a very traditional individual, healthy living approach to one that really embraced who they were, their spiritual and cultural identity as young people, from different populations. So it was quite remarkable. This is, I'm just showing a bit of what we found, but I thought this was really significant. This one also I thought was really beautiful. Being with your family brings you happiness and stability. That's all part of being healthy. So they really shifted the way that they thought about their family and the supports that they needed. And that is another example. And this one I thought was really interesting. This one particular youth took a picture of this playground. It's a very sad looking playground. And what they explained in their narrative as part of their photo voice is that it was not safe to be out in this neighborhood. And so there were no children playing in the neighborhood. So this has really got them to understand that if they were actually going to be, owners of this concept of, having control over the conditions of their health, that they needed to have an impact at a much larger level. So their leadership development of getting them to start with, the Youth Warrior program, how do we get you to be more healthy and sleep better and manage your diet better and get you out for physical activity, shifted to how do we actually become change agents in our own society. So it was really, really remarkable. The other project that I'm going to talk about today is something that I've been involved with at the Simon Fraser University where I teach. This is our cohort of Health Change Lab students. So the change agent concept, I've kind of kept building on it. And this actually, we just launched it in fall of 2016. So we're pretty excited about it. It's the first time that we're actually partnering on this, and I'm working with a co-instructor from the BD School of Business, and he has actually been working with this concept of the change agents. He established Change Lab a few years ago, and he's been working with the Faculty of Environment. So when I found out about this fabulous program, I said, hey, could we partner up and do a health change lab? So just to talk a little bit more about what the Change Lab is, we call it a heads, hand, and heart education. And what it is really, it's based on experiential learning. So the students here, they are in a retreat where they're actually having to come up with their own grade contract and how they are going to be evaluated. And we do a 360 review with them. So they evaluate themselves, their peers evaluate them through their team assessments, and then the instructor evaluates them. And it's set up sort of as a studio-based, like a full-day program. We have lots of guests coming from the community, from Fraser Health and from the city of Surrey, but they are also out in the community every week, and Marco will attest to this, because they have to be interviewing a ton of people every week in order to bring it back to the class and continue on with their projects. So what I love the most about this program is, for me, it's about bringing health promotion values and principles, combining it with entrepreneurial skills, and really putting health promotion at the heart of this, which is what I love. Next slide. So here are some of the partners. This is actually the first day. This is the first day, September 6th, and we just finished a tour of Fraser Health and the City Hall and SFU, and now we were in a panel there, and you can see the circle up right on the first day of class. There was a panel of experts that were coming from each of these institutions to talk to the students to help them set the context in terms of like what were the priorities that they were working on, and some of the challenges that they were facing. And so we have been really honored to be working with an incredible network of community partners. So they have turned into the mentors in the program, and I think that Marco will tell you a little bit more in a minute. The next slide. So this is, I like to use the circle in different ways. So at first it was we called it the executive panel of all these different institutions coming together to set the context. But then I also used it in the classroom around how do we frame, these concepts that we've been talking about, very importantly around the determinants, holistic health, and also the values and principles. Because the students are actually designing entrepreneurial solutions. So they're identifying a problem, and we can look at that. These are the 4 issues that they're working on. These issues were identified by the community partners, not by the students. Okay, so I worked for a year in advance with the community partners to identify the issues, but then they basically had carte blanche to figure out, okay, so active transportation is a huge issue in Surrey, and they started to do an example of root cause analysis, so actually drilling in to the issue of what do we need to understand about active transportation in Surrey? You know, what are the factors that are really important? How do we engage others in this process? So the circle of health, as you see there, was one of the students was using it around doing this root cause and actually asking those who, what, why questions to drill down. And that's where we really got to the crux of it, because that helped them identify how, which direction they're going to be taking their entrepreneurial solution in. Next slide. Okay, so I'm going to actually ask Marco, because he's in the class, to speak from his experience how he has used the circle or what it's brought for him.
Thank you, Paula. Hi, everybody. My name's Marco, and I'm in the Health Change Lab. And just before I want to start, I always want to come to PI, so I'm so happy I'm here. So just before we getting started, I could say so many things about Change Lab, but I really want to focus on how we've used the circle and the impact it's had on our class. So just to give you a setting, in our class, it's not just health science students. It's not just students who want to go into public health. There's business students, interactive arts and technology students, psychology students. So there's a huge diverse background there of students. So one of the things that we come into the class is we have to build a social venture, and we have to use entrepreneurial solutions, but we also have to have that health background a little bit to kind of guide us. So the first day I come into class, my group consists of 2 business students and an interactive arts student as well. So we asked, well, what do we want to address? Active transportation. Sounds good. So the first thing they said was, okay, so let's give rides to everybody and we're done. That's not right, right? We want to empower people. So we had to ask that larger question. And then so many people have actually brought up this just today as well. When I say I'm a health science student, people assume, do you want to be a doctor? Do you want to work in healthcare? No, I want to work in health promotion. So what the circle has really done, especially for some of my other students, they've really said, okay, well, let's look at this problem from this point of view. So we get our circle of health out, we ask ourselves the questions, and they say, oh, okay, so maybe this has more to do with transportation than not having a car, right? So that realization is quite astounding for a lot of people, and just to go with everybody else, that's the aha moment, right? And in terms of building our social venture as well, the circle of health really guides us. So instead of making these assumptions about the population we're working with, it really asks us, what questions do we have to ask our population, and how are we going to make this effective for them? And we also have to keep in consideration, and the circle of health always checks this for us. They say, why are we doing this, and what do we have to do to address it, versus just making assumptions but what we think is going to address it. So it's been very valuable in that sense. I don't have too much more to say. I'm here for the conference as well, but I don't have too much more, so I'll give it back to Paula.
He has a lot to say. Thank you so much, Marco. Yeah, so just to build on that, so we've got 7 interdisciplinary teams, as Marco just mentioned. We've got business, about half of them are health science students. Interestingly, the health science students some of them have taken a health promotion course. It wasn't my course. So they didn't actually have the Ottawa Charter background. So a lot of them were coming from more from a health education model, which is really interesting. So they walk into this class, they think they know everything about health promotion, and then they're totally blown away, right? So that's been really fascinating. And the other thing, as Marco mentioned, we've got some really interesting mix of students. So every group of these 7 groups, they're working, and really having to learn about their own, philosophies, where they're coming from. And I think that, the best, I guess, summary is really it brings a common understanding. So people who don't have a background, or who might think they have a background, but they actually are challenged while they start using the circle to actually get a better understanding, and then really be able to dig deeper into questions that are actually ultimately going to be able to produce a better solution in the long run. So I will definitely be able to share more, because this is ongoing right now, and they're going to be doing their final presentations on November 29th. So hopefully we'll have even better news to share, Patsy, at the end of this. So thank you so much for the invitation, and I look forward to hearing from and learning from the rest. Thanks.
any specific questions? Rebecca.
Yeah, sure. I have a question for Marco. I don't know if you're that far along yet in your process, but could you give us a hint on what kind of project or entrepreneurial initiative you might implement or looking at?
I have a very soft voice, so I'm going to use this. So for my project, we're trying to think about how we want to connect seniors to their communities using active transportation. So when I first started the class, just to show you the progression, I thought of seniors as kind of one group. So I didn't think there was different levels of ability, able-bodied versus frail. There was kind of a huge assumption that, oh, I'm gonna talk about seniors, so I'll just design one problem. It's a one-fit-all solution. So about 1 week later, from the very gentle advice of our facilitators, they kind of said, you're wrong. So that's just being honest. So as we progress, we kind of determined that the best place that we want to intervene is when people are just becoming seniors, so when they're around the age of 65, and how we can deal with driver cessation. So when we really understood that the problem wasn't that seniors can't get somewhere, we understood the problem was seniors are so used to, in my community at least, they're so used to using the car as their means of transportation. When they can't drive anymore, there's not a backup plan. So that was the real issue. And without looking at the issue as just people can't get somewhere and trying to figure out why they can't get somewhere, that was our root problem. And if you asked me 2 months ago, I would have told you that, there's not enough people with cars, or there's not enough people who can drive. And it's just not accurate. So it's just kind of digging down deeper. Somebody want this?
You can keep talking.
Sure.
You tell them where you are now.
Yeah, so where we're at now, we're actually testing different prototypes, and we're kind of set on one, but we have to keep an open mind as well. And there might be some flaws in what I'm about to say just because we are halfway through, so don't fault me. But we're trying to basically make some kind of interactive platform where people can actually wayfind, but they can wayfind using active transportation. So that's where we kind of differ from Google. And we want to suit our intervention basically for seniors. So we want to determine what's the safest route we can get here, what's the most time efficient, what's the most affordable cost. So we're just kind of working on that, and hopefully it takes us to, our end goal.
Thank you. So our fifth panelist is unfortunately not able to be with us today. It is Dr. Cesna Semic, and she is the president of the Serbian Public Health Association. She sends her regrets due to the declining health of her mother. So we just recently learned that she wasn't able to join us today. What she has done for us, though, is shared her story in a write-up that she sent to us on the 12th of October. And so the Circle of Health in Serbia, the Public Health Association of Serbia, is a membership-based, non-governmental, not-for-profit association that advise on and facilitate the formation of sound policies and programs and promote the application of good health practices. It was established in October 2003 by a group of like-minded public health professionals who felt the need for the association and who were inspired and supported by the Canadian Public Health Association and funded under the CETA project, Strengthening Essential Public Health Functions in the Balkans, 2001 to 2005. Today, the association is regularly registered as Serbian NGO and has about 100 active members. During the CPHA annual conference in 2008 in Halifax, delegates of the PHAS had a chance to be introduced to the Circle of Health as a useful tool to assess and evaluate need and develop health promotion strategies. On the request of PHAS, financial and logistical support was provided by CPHA for translation of the Circle of Health to the Serbian language and organization of a summer school entitled Determinants of Health, Understanding and Implementation of the Circle of Health in June 2009 for education of PHAS members to use this tool. In 2010, another summer school was organized where the Circle of Health was used for project development in areas of drug abuse, smoking prevention, and prevention of alcoholism between youth in local community. The Executive Board of PHAS recognized the importance of the Circle of Health in contributing to a better understanding of determinants of health and partnership development in local community. So a lot of efforts were put into preparation of teaching materials and mobilization of members from Serbia and neighboring countries, Macedonia and Republic Srpska, Bosnia-Herzegovina. Representatives of medical faculty, University of Belgrade implemented the Circle of Health in teaching undergraduate medical students in health promotion research and practice. Examples of the students' exercises with the Circle of Health are now part of the textbook of social science medicine published in 2012 under the chapter Health Promotion, page 149 to 169. Editor of the textbook is Professor Dr. Cesna Simic. Students were preceptive in introducing new approaches and tools in teaching. In PHAS, we have discussed about accreditation of a course with implementation of the Circle of Health in health planning, health promotion. But a limitation is that we have not enough copies of printed materials. PHAS has limited financial resources, so we are considering various possibilities of how to overcome them. One idea is to organize CME with a selection of social science, social medicine in the Serbian Medical Association, and to renew focus on health determinants in the work of a network of public health institutions in Serbia, particularly at the local level. We hope that this will be realized next year. Thank you. So this concludes our panelist portion of the afternoon. And so what we're going to do now is take a bit of a break and that walking tour to the room where the inspiration for the Circle of Health 20 years ago was founded. And then when we regroup, we're going to spend the rest of the afternoon together sharing and learning from and with one another. So the panelists will come, and if you're interested in education, policy, integration into health system, the team will be here and working with you. So we'll have lots of conversation to learn what you're doing in your practice worlds and where you see the circle in your lives or how you could see it unfolding with you now, today, and tomorrow. So Patsy, tour time.